welcome to another edition of Health Watch. Yes, coronavirus is still ravaging the world and is dictating the pace at which a lot of things are being done. Aside from coronavirus, there are other ailments that are a big threat to human life. One of such is cancer. Now we have different types of cancers. We have breast cancer, we have cervical cancer, but today on our program, we'll be talking about blood cancer. This is not a very common kind of cancer, but people have also come down with it. And we've also had survivors. So our doctor today will tell us all we need to know about blood cancer. Plus, we'll have a feature on what are the medical practitioners, what are they doing about managing this period? How do they cope with their mode of operation? And how do they ensure that the staff and patients are safe this period? All of this you'll get on this week's edition of Health Watch. My name is Nkem Okibi. You know I'd love to see your face every week. We'll go on a short break. When we return, Health Watch continues. Stay with us. If you're just joining us, the program is Health Watch, reaching you on the station for excellence, NTA Lagos Channel 10. And before we went on the break, I told you that our topic today is on blood cancer. With me in the studio is a hematologist in the person of Dr. Yusuf Adelabu.
Thank you for having me.
You're welcome to the program. Now, let's look at cancer generally. What is cancer?
Cancer refers to a large group of conditions whereby cells in the tissues actually grow abnormally and grow out of order, thereby leading to those tissues becoming much larger and also impairing their function. And cancer can actually affect virtually any tissue in the body, right from the head to the toe. So you have breast cancer, cervical cancer, prostate cancer, stomach cancer, and even blood cancer, as we'll be discussing.
Okay, so blood cancer, what would you say? What are the causes? What are the major causes?
So blood cancers, like all other forms of cancers, the specific or one cause of it is not known. There are a number of factors that have been shown to be associated with development of cancers. Okay, one of it is genetics. Some cancers actually have a genetic predisposition. So if one has some genes in the body which can actually be hereditary or can be inherited from one's parents, can predispose to some type of cancers. But generally, blood cancers have not been shown to really come from genetic factors, more from environmental factors. And what are these environmental factors? Part of it actually involves radiation, exposure to radiation. So if one has exposure to radiations, either from power plants or from nuclear plants or other forms of radiation, could predispose one to developing blood cancer. Another group of factors that could be responsible for development of blood cancer are infection. Certain type of infection predisposed to some type of blood cancer. Say, for example, HIV infection has been associated with some form of cancer. Some other organisms, bacteria, viruses, have all been linked to some form of cancer or the other. So the factors responsible for that are actually so.
So how do you know you've come down with blood cancer? Because it's very important that when you have a sign or you know the symptoms already, so you can actually say, oh, I need to see my doctor, I don't feel well, and all of that. So but you know how it is. The blood, you don't get to see your blood except you have an injury. It's just in our body, flowing in our body. So how do you determine as a person that I need to see my doctor, I think there's something wrong? So what are the signs and symptoms?
So there are some signs and symptoms that could point to possibility of there being a blood cancer, even though these signs and symptoms can also be caused by several other conditions. Because in the blood we have three major types of cells: the red cells, the white cells, and the platelets. The red cells help to carry oxygen throughout the body. The white cells are the soldiers that help to fight infection, and the platelets to prevent bleeding. So one of the commonest symptoms of blood cancer is actually feeling fatigue due to low or shortness of the blood level. So fatigue, weakness, shortness of breath, or even fainting spells. Other symptoms include, as I said, the white cell are helping to fight infection. So predisposition to infection or recurrent infection is one of the triggers or one of the pointers to blood cancer. And for the bleeding condition, bleeding tendencies, wherever there's an abnormality either in the function or the number of the platelets, could lead to bleeding conditions. So those are things that would help to point out to the possibility of there being blood cancer. But some blood cancers can also lead to some swellings in some parts of the body. So there are some tiny bean seed shaped tissues in the body, we call them lymph nodes, they are present in some strategic areas of the body, in the neck, in the armpits, in the abdomen, in the groin. So when they become enlarged as nodes, so those could also be, pointers to the possibility of there being blood cancer. Although, as you said, you can't see the blood, so the blood still needs to be tested before that can be confirmed that it's blood cancer or if it's from some other conditions.
How common is it in this climate?
So comparatively with other forms of blood cancers, blood cancers actually are the third to the fourth commonest forms of cancer in our environment. Particularly, the group of cancers we call lymphomas. The commonest form of blood cancers, in our environment and worldwide generally. But in children, blood cancers are actually the commonest forms of cancer generally in children. So it's actually quite common, even though as we don't have proper statistics for most of the conditions in our environment, but we do know that from projections that it's one of the commonest blood cancers, but definitely not the commonest. Breast cancer, cervical cancer, lung cancer, prostate cancer are still way much commoner than blood cancers. But we have people in our climate that do have blood cancers and also do get to survive.
But you just mentioned that it's also common amongst children. How come? Because I remember that you also mentioned that environmental factors are one of the causes that could trigger someone having blood cancer. So I'm sure that children do not go to areas like that. So how come it's common amongst children?
So the blood cancer that has been shown to be common in children, the underlying or predisposing factor has not been clearly understood. But some of the cancers are actually of genetic origin because in a child, still developing cells. Because most times the way cancers develop is that while cells are proliferating and increasing number and trying to form tissue, along the way something can go wrong and those cells can go rogue and become cancerous. And that's why in children, having to form new tissues and new cells, childhood cancers, in which blood cancers are a type, can actually develop in children just because of the fact that those cells are rapidly growing and anything could go wrong at any point in time.
What's the level of awareness people have out there concerning blood cancer? Is there a month you celebrate blood cancer? Is there something you are doing about it to ensure that people know about blood cancer? Because it's possible you go out on the street and somebody is telling you blood cancer, I've not heard that before, are you sure it exists? So how do you create some level of awareness? If people are aware, then they can go to the hospital. Then they can also look out for their bodies and say, oh, I have some lymph nodes swollen here and there. I should see my doctor. That is because you are aware. But in a situation where you are not aware, you are not knowledgeable about it. So you sit down there and you know how it is for cancer. They say early detection is key. So if you don't know, how do you go to the doctor? How do you attend to your body?
I could say the level of awareness of blood cancer in Nigeria is extremely low. And that is one of the things that have actually, prompted us to actually start, a movement or a campaign to actually increase the awareness of blood cancers in Nigeria. Every year, globally, September is dedicated as a Blood Cancer Awareness Month. So as a foundation, we have actually put together an awareness campaign program, throughout the month of September to raise the awareness, in our society and make people more aware of this condition and also ensure that there's adequate support for patients with blood cancer to improve their survival in Nigeria.
Now let's talk about the survivors, because you just mentioned that. Do we have survivors? You know how it is if you have survivors in a particular ailment, it gives people, that is like a testimonial for people to say, oh, I know I'm going to be fine. I've seen a couple of people that have survived blood cancer. So what's the survival rate of blood cancer?
Interestingly, blood cancers are actually one of the most curable cancers generally in the world. And so people are surviving. It's just that in our environment, due to some of the challenges we have in the management of blood cancer patients, I prefer to say that the survival rate hasn't been as good as would have been expected. And that is part of what we are trying to ensure that we get to improve on. We want to improve the survival and the quality of life of blood cancer patients in Nigeria by ensuring that the diagnosis is made early, and ensuring that they get the best treatment and that they actually achieve a cure.
Okay, you just mentioned challenges that blood cancer survivors go through, or the challenges that you as medical practitioners go through in attending to people with blood cancer. So we'll go on a break. When we return, you'll be telling us that. We'll go on a short break now. When we return, Health Watch continues. Stay with us. Welcome Welcome back. The program is still Health Watch, reaching you on the station for Excellence NTA Lagos Channel 10. And our topic today on Health Watch is blood cancer. My guest is still in the house, Dr. Yusuf Adelabu. Thank you so much for this opportunity, and thank you so much for sharing a lot of things we need to know about blood cancer. Before we went on the break, we talked about the awareness that is being done every year. The awareness that is being done every year, and you talked about challenges, and so that's what prompted that question. What are the challenges that medical practitioners go through taking care of or managing people with blood cancer, and what are the challenges that the blood cancer survivors also go through?
So I'll start with the challenges of being the blood cancer patients in themselves. One of it also, of course, is definitely even getting adequate medical attention in terms of being able to get to the specialists that would help to diagnose. So we see a lot of people being diagnosed pretty much late, having treated for malaria, typhoid for months, only to down the line now eventually diagnosed with blood cancer, which would have been detected much earlier because of the fact that the specialists, those that actually manage this condition, which are, in my field, the hematologists, are actually quite few in Nigeria. That is one, major challenge about blood cancers in Nigeria. Another challenge is actually even the diagnosis. Some of the diagnostic tests, of course, majorly to diagnose blood cancer is to look into the blood and also the bone marrow. Some of the advanced tests that needs to be done to confirm certain type of blood cancers and also give appropriate therapy are actually lacking in Nigeria, and most times we rely on laboratories outside the country, and this further delays the diagnosis and initiation of treatment on time, and that also affects survival ultimately. One of the major challenges is even the medications to use. In other climes, there have been a lot of advancements and development in terms of drug treatment, medications that can be used for treating blood cancers. Many of them are not available in the country, and even though some of those that are actually available within the country are still quite very, very expensive. So a lot of patients are not able to afford those specific and adequate treatments to actually even make them go into remission and or even achieve a cure. And that's part of what we're trying to not only raise awareness, also help support blood cancer patients to ensure that they get the best treatment that would ensure their survival. One major challenge, which is still, really very much, not really, coming up as we expect, is that of bone marrow transplantation or having transplantation, which is like the ultimate treatment to achieve a cure in most blood cancer conditions. Currently in Nigeria, stem cell or bone marrow transplantation is not readily available, if at all available. And not only to even talk about blood products that are even needed to support these patients before they undergo the bone marrow transplant and even afterwards. So those are some of the many challenges that blood cancer patients face in Nigeria. Of course, the healthcare practitioner, in this case the hematologist, also having to grapple with this challenge, and also survivors as they cope with their condition.
All right, tell us, what are the types of blood cancer we have that are common in Nigeria?
So generally, blood cancers are divided into 5 groups. So there's a group called the leukemia, the second group lymphoma, third is myeloma, the fourth is the myelodysplastic syndrome, and the fifth group is myeloproliferative disorders. So of these 5 groups, the commonest is the first two, that's leukemia and lymphoma. Leukemia are blood cancers that develop from the blood and the bone marrow, while lymphomas are blood cancers that actually develop in cells in the body or tissues in the body we call lymph nodes. So the commonest blood cancers, worldwide and even in our environment are the lymphomas. There are 2 broad groups, named after that first identified the condition, called Hodgkin's. So we have Hodgkin's lymphoma and non-Hodgkin lymphoma. So non-Hodgkin lymphoma globally and even within our environment is the commonest form of blood cancer. The second commonest are the leukemias. And the leukemias are broadly divided into 2 groups, depending on how rapidly they develop. So we have the acute leukemias and the chronic leukemias. The acute leukemias are rapidly divided and rapidly developing leukemia that, if not treated within weeks and months, can result in death, while the chronic leukemias usually are less rapidly developing and, if not treated between months to years, can also be life-threatening. Even though chronic leukemias can actually go on for years without even any treatment, but if treated, those actually have the possibility of ensuring that it doesn't progress any further.
Wow, this sounds a bit complex for me, but you know how it is. The good news is where you get to see the survivors, and you know that you are aware that you have survivors in this kind of and have this kind of cancer. That's good news for people out there who have come down with blood cancer. But again, the question is again, how can it be treated, or is it an ailment that can be managed, or can it be treated and you be cured entirely? You don't have blood cancers anymore.
So in terms of the treatment or management leading to a cure, there's a very large spectrum when it comes to blood cancer, because there are so many. There are dozens, if not even hundreds of blood cancer, different types and subtypes. Some blood cancers don't even require to be treated at diagnosis, because they've shown not to really cause any major problem for the body, so we just get to observe and watch. But on the other extreme, some blood cancers need to be treated immediately, otherwise could lead to death in weeks or even months.
Wow.
So as regards the treatment, the usual aim of the treatment is to achieve what we call remission. Remission is when you get to bring down the level of the blood cancer cells to the barest minimum, which will still allow the body to function normally, but it doesn't eliminate completely every leukemia cell or leukemic cell in the body. But some blood cancers can actually get to level of achieving an 100% cure, even though most times that is achievable by the stem cell transplantation, in which very massive and intensive treatment is given to wipe out the entire blood cells and the marrow, and a new set of cells and bone marrow cells are infused back into the individual to repopulate the marrow and the bloodstream, and thereby eliminating completely every form of leukemia in the cell. So if your question is, can blood cancers be cured? The answer is yes.
So there is hope.
Surely there's always hope.
All right, thank you so much. Finally, in just 1 minute, what's your advice or your message to everyone, to the viewer that is watching right now?
My message to Nigerian population is to first be aware that blood cancers are in our environment, and we need to know about it. We need to also know that we need to support blood cancer patients, and know that blood cancers are not a death sentence. That if it detected early, if appropriate treatment is given and necessary support is also given to these individuals, that hope is always there for blood cancer patients in Nigeria.
Thank you so much, Dr. Yusuf. Thank you for coming on Health Watch. Thank you for bringing hope to a lot of people out there who are struggling with blood cancer, or if you know someone who has blood cancer, thank you for giving us that hope, and thank you for re-emphasizing the fact that you are out there, also creating the awareness for people to know about blood cancer. Thank you for coming on Health Watch.
Thank you for having me. It's my pleasure.
All right, moving on, we have this feature on how are medical practitioners, how are they coping right now with the COVID-19, in terms of their mode of operation and their safety measures to ensure that staff and patients are safe. We'll be right back. Enjoy it. Health is wealth is a popular cliche used to describe health as most valuable and precious to every individual. Good health does not only mean the absence of disease, but a complete state of physical, mental, and social well-being of a person. Medical practitioners have continually emphasized the importance of routine medical checkup. However, with doctors as frontliners in the battle of coronavirus, they face a lot of risk this period, which has affected their mode of operation.
As a clinician, you must have an index of suspicion and also develop a guideline to decide, who you are seeing, ask questions, take history, and take, a proper observation of who you are seeing.
And we are encouraging a lot of people to book appointment online, and then through phone. When you book your appointment through phone, we would have asked you basic questions and define for us the safety.
As researchers globally continue to search for the right medication and vaccine for coronavirus, one cannot rule out the fact that there are still other ailments, so patients must visit the hospital, while the health providers put strict measures to keep staff and patients safe.
We know that COVID-19 is real, so we're not playing with it, because we know the things that are happening. So everybody who comes in, because we go out and we interact with other people outside the hospital, so when we come in, we also check like any other person. Every staff must go through the checking before coming in. But generally, like just coming in from outside, you've got to wash your hands, you got to sanitize your hands, your temperature will be checked. A little history. It doesn't matter who is coming in. We get that before staff come in.
As hospital, we take extra precaution to see our patient. For example, you can't enter this office without a mask. There is a no mask, no entrance. And I want you to understand that now it's not the right thing to just go to any hospital you have not been going before. That is one of the challenges we see. Patients that are our patients, that we have their records, we know them, we know their elements, we know their itineraries. Whenever they come, we still attend to them. I won't pass through all the protocol. But those that are just new, we try to see whether to attend to them or not, based on do they have a reference letter.
The world is getting to know more about coronavirus. And so for every new day, there is a new knowledge, a new aspect of what we need to do and what we need, how prepared we have to be for coronavirus. It's a virus that is here to stay for quite a long time. And definitely the world cannot shut down all through this period for coronavirus. We will eventually conquer, we will come through it, but for all of us, we will need to keep abiding by the set standards and ensure that we keep ourselves up to date with current news and latest information as they unfold. That way, we can be safe and stay out of trouble of coronavirus.
Medical practitioners play a vital role with their dedication and commitment to the COVID-19 response. We must all take responsibility, obey government guidelines, and follow all precautionary measures to contain the virus. And that's much we can take on this week's edition of Health Watch. Remember that for cancer, early detection is very important. Once you notice something, you feel something in your body, please see your doctor, alright? And if you have any question, you have inquiries to make, send it to ntalagoschannel10@gmail.com or okibinkem@gmail.com, or send a text only to 07060865487. Remember that health conscious people live longer. My name is Nkem Okibe. See you next week.